May 18th, 2025, we're here at the Doubletree Hilton for the Dominican Medical and Dental Association Congress. It's a beautiful event, and I was invited by their executive committee to give us a talk, a little bit of a speech or a presentation, what have you, on what's been happening with opioid drugs, vaping, fentanyl, amphetamines, even some of the psychiatric drug consequences, and really the state of our communities. And what are the alternatives? What are the alternatives of exercise, of a good diet, of good relationships, of really just doing what we like so that we get pleasure out of life? And so I'm going to give a conference on that and how we can do prevention, how we can use the body's own endorphins, which are body's natural highs, the endocannabinoids, which are also natural and give us highs. And why do these highs come out? Very interesting, from good behavior, from good conduct, from good nutrition, from exercise. All of these things, like nature planned and built in to what we should be doing. So I'm going to begin a talk on that. I'm very honored, and we'll be starting soon. And I want to just let you know, I want to thank Dr. Jeanette Gomez, one of the directors of the dental group, and Dr. Ramon Talaj, a very big medical leader here in New York and across the world, and all of the organization. I want to thank Somos and Community Care. Thank you so much for this opportunity, and I hope you enjoy the videos. Here we go.
We have special guests here with special presentations that we're all going to enjoy at lunchtime. It's a surprise for you all. You're going to enjoy it. It's something that we have been able to accomplish. Thank you, Dr. Fialkoff. We have Dr. Hong here, who will have this presentation. Especially in a year like this, it's very important to share that message that you're all going to see at lunchtime. We're going to start off with our first speaker. Let me move to the podium here. Dr. Bernard Fialkoff. Dr. Bernard Fialkoff is a class valedictorian of SUNY Brook Dental School, and Alpha Omega and Okun Academy Awards, Pierre Faucard Award, International College of Dentistry Fellowship, Periodontal and Dental Implant Specialty Postgrade, and Memphis VA Hospital University, Tennessee Dental School. He has a private practice in Bayside, New York, and founder of the Fialkoff Dental Study Club Implant Certainty Training Program. He's president, founding sponsor of the Foundation of Drug-Free World Americas chapter, drug education speaker at 6 UN events, the NYSDA Chemical Dependency member, International Freedom Medal winner for drug education in 2016, ran opening NASCAR Bell for Drug-Free World in the Americas chapter in 2017, founder and producer of Time for Truth. So he has been with us before, and we all enjoy his presentation. He's a very clever guy, very funny, always bring us interesting topics. And today we're going to talk about opioid management as part of the mandatory courses that we all have to take to maintain certification in the state of New York. So he's going to help us get through a couple of those credentialing that we need to accomplish those hours of opioid management and bring us some light on the new changes that society are facing and the physicians and dentals are facing with the opioid crisis. So without further ado, thank you, Dr. Fialkoff, and you may start.
Well, buenos días. How many don't speak Spanish? No problem. Okay. First of all, primero, I want to thank you. I think our world suffers from lack of acknowledgement. U.S. Surgeon General, the physician in charge of the country, Dr. Vivek Murthy. Our epidemic of long isolation, 2023, not 2016 or 2020, 2023. The U.S. Surgeon General's advisory on the healing effects of social connection and community. The U.S. Surgeon General is sounding an alarm. Americans are more lonely and socially disconnected than ever. And now this is a quote from his article, direct quote. Go online and check it out. U.S. Surgeon General is sounding an alarm. Americans are more lonely and socially disconnected than ever, and it's a serious threat to their physical and mental well-being. And mental health that demands urgent policy action. Demands urgent. Definition of urgent means yesterday, now. A new report from the Surgeon General says that social isolation's effects on mortality are equivalent to smoking up to 15 cigarettes a day. I think it's important that I get that to you. What else does he say? More social connection is linked with better health. The Surgeon General's report notes that one of the first large-scale epidemiological studies conducted in the 70s found that people with a low amount of social connection were more than twice as likely to die, even after adjusting for age, health, and economic status. I don't have to quote anybody else. That's the doctor in charge of the country. He tells other people what to do. Now I'm going to go back real quickly, but I had to give you that because I had to just give you what the latest is. Now I'm going to give you something else. Now I'm going to give you this because now this is the Secretary of Health and Human Services. I think he's in charge of the country's health care. So let me see what he says. Is that our diet has been so horrible in America and that we're suffering from mental and physical diseases because of our diets. Very important. How do you do your stewardship? Because it's a CME course. You check the prescription drug monitoring program that we spoke about already. Number 3, you talk to the patient, like I said before already, about the risk benefits of this. Number 4, you pair an opioid with a non-opioid alternative. NSAIDs, acetaminophen, we talked about that already. They also want you to do non-pharmacological therapy such as physical therapy, daily exercise, ice, heat, extroversion, massage therapy can be used as adjuncts. Avoid opioid use for chronic or undifferentiated pain. Refer them when you need to. You know, you have a doctor back there who's my friend. He and I are actually friends. So you're probably surprised, but we're not because we're helping people. We try to help people. Sometimes you have to refer. Refer. When you have to refer, refer. Offer naloxone. We've gone over this. Certain patients are on benzodiazepines, psychotic drugs, SSRIs. Okay, but it's a no-brainer. So if you have to prescribe, probably should give them Narcan also to make them safe. And you probably should really educate them very well. You're probably like me, you don't have a lot of time in your practice. Get your staff to help you with this. That makes sense. We okay? Okay, good. We went over this already. I think something important, the Hippocratic Oath that we all take. I will follow that system of regimen, which according to my ability and judgment, I consider for the benefits of my patients, and abstain from whatever is deleterious and mischievous. I will give no deadly medicine to anyone if asked, nor suggest any such counsel. One deadly medicine is fentanyl. You see how many it's killing every single day. So I would say that we have a crisis. Now, I gave you this one already. Vaping is not innocuous. Vaping was getting so horrific with young children that the government realized this. So let me give you very quickly. The vaping media, that means the liquid that carries the vaping, is either vegetable glycerin, which dries out the mouth. You know, I'm a dentist. What does it do? It causes cavities and gum disease. Is that not innocuous? No, because then you have to spend a lot of money with me. And if your kid ends up having all these cavities, you're going to be madre. How many cavities do you have? That's from vaping. because they drive xerostomia. Vaping. Now, but guess what the other media is? One is vegetable glycerin. Who knows what propylene glycol is? No man can answer. It has to be a woman. Propylene glycol. Guess what that is? That's one of the media. You can't answer. You're a man. It has to be a woman. From the women, who knows about this green liquid that sometimes you see in your car? It's for the winter in New York.
Antifreeze.
Propylene glycol is antifreeze. You said, but Fialkoff, you're making this up. This is CME course. Don't do that. I love you, Don. I'm just busting your chops. So here, that's right. Propylene glycol is one of the media used. You say, words there, impossible, Fialkoff. It can't be. It's true. But it's only a little bit, so it doesn't hurt them too much. Just a little bit. And it causes xerostomia also. Okay, now, let's go to the next thing. The flavorings. Well, it's just a flavoring, Fialkoff. Relax. The flavoring, diacetyl, which was used to make butter-flavored popcorn in the factories in the ambient air, like here, caused popcorn lung. What does that mean? Bronchiolitis obliterans. Their lungs got obliterated. So you think that they would eliminate that, obviously. No. They made it different flavors, and they put it in the vapes. Now you know why the kids died. Because the kids were getting popcorn lung. Look online. They were getting popcorn lung. Bronchiolitis obliterans. Constricted. Diacetyl is found in many e-liquids. Unbelievable. Unbelievable. Now, there's other flavorings. Maybe they're not so bad. Let's take a look. One is cotton candy, ethyl maltol. It aids transport of heavy metals into the cells. So you go, well, okay, but they're vaping. Where are you getting your heavy metals? Remember what I told you, what comes from China? Read this. The heating element has toxic heavy metals. Arsenic, chromium, nickel, and lead. Reference, Johns Hopkins University, Anna Maria Dual, PhD. That's where you get, just look it up online. So if you have heavy metals in the metal that's caught in the heating, and you take ethyl maltol, which is this cotton candy flavoring, kid probably likes that, right? What happens? You transport the heavy metal of the vape, of the metal, into the system, on top of the dry mouth. Woo! Yeah, that's right. Now, we're not done. Now we have nicotine. Then you say, well, but Fialkoff, you know, they can get nicotine flavoring. No. You say, Fialkoff, they can use nicotine-free flavoring. No. 99% of the flavorings, whether or not they're labeled, whatever they're labeled, it's false advertising, 99% have nicotine. What does that have to do with anything? Well, it's just nicotine. I'll tell you what it has to do with it. Affecting control of attention. Whoa, that's interesting. There's a whole syndrome about that. I wonder, you think if they stop vaping, maybe some of them would not have a problem? I'm not telling you that all of them. Nothing in life is all in them. Okay. Affects their mood. Maybe it affects their impulses. Maybe they do some violent activity. Now, what happens? They breathe the vape, nicotine goes in, it goes up to the brain. It elicits the dopamine receptors. We have natural dopamine. Dopamine's not a horrible thing. We have it in the body. So you release dopamine. But what's happening now? It's artificial. You're not releasing the dopamine because you had a good time with your family. You're not releasing the dopamine because you exercised, you did a nice crown, Danny. You know, no está saliendo el dopamine porque hiciste algo bueno. Está saliendo el dopamine porque te dio una nicotine. So that means you get addicted to the nicotine. That's how dependence starts. It does something for you, and then your body stops doing it, and what happens? Now you have to have this thing for what your body used to do by itself, and now you're addicted. So the nicotine in these people affects them, and now they're vaping all the time. They say, oh, Dad, I'm just vaping. Ma, come on, Ma, leave me alone. I'm vaping the flavoring only, Ma. But that's not true. They have nicotine. So that's what happens. The CDC found 99% of the flavorings have nicotine. Now, I want to give you something that'll blow your mind. This is the New England Journal of Medicine. What happens when they vape? Look at this. You ready? Look at this. When they vape, read this here. What's it say? Somebody read this. Anybody. Marijuana, right? Now here, marijuana. What percentage? 50%. If they vape, half of them will take marijuana. If they vape, 43% will start drinking. Just because they vape, not because they're upset, they're at a party. This is statistics, New England Journal of Medicine. You know, you're worried about your daughter. If they vape, 45% have sex when they're young. Why is this important? American Journal of Psychiatry. Conclusion: cannabis use appears to increase rather than decrease the risk of developing non-medical persistent opioid use and opioid use disorder. I don't think you have to say anything more. There you go. There you go. They use cannabis. Where do they go to? Beautiful. Now here we go. We're going to do something. Say, I'm a doctor. And I'm going to save my community. And that's going to make me really happy. Okay, now you ready? Now do it with some real enthusiasm, like before a baseball game, fashion show, dinner, China, boxing match. Ready? Are you ready? Here we go. I'm a doctor. And I'm going to save my community. And I'm going to be happy. Thank you.
Amazing, amazing. Thank you so much.